Thank you. So yes, I'm talking about the particular pathway of health, safety, and well-being of young adults in higher education. And this is an immense topic, and again, I have about 15 minutes, as we all have, to cover it. So I've narrowed it down into three particular topics that both research sort of identifies as particularly concerning for college students, and those of us who are administrators and service providers also know to be concerning, and that's alcohol use, mental health issues, and sexual violence. Now, these are by no means the only issues college students are facing, but they are significant. So what I'm going to do is briefly sort of review what the prevalence of these issues are for college students, and then talk about some of the gaps between the services that are available and the students who aren't accessing them, and then sort of cover a few intervention strategies for education intervention, and then try to put it into some context and show you how we do incorporate some of these strategies at the University of Washington. Oh, wow. Yeah, sure did, sorry. Hey, a right button, not the bottom button. Okay, I apologize. So we all know that college is an exciting time. Students are exploring things, they're testing boundaries, they're typically living in peer communities, and they're under a lot less parentally regulated environments. So as a result, they're pushing those boundaries, and sometimes that gets particularly risky when alcohol and drugs are involved. There's been a particular concerning finding that almost half of college students and their non-college age peers have met the DSM-IV criteria for at least one psychiatric disorder in the previous year. And the two most common disorders identified for college students in particular are alcohol use disorder and personality disorder. It's pretty significant statistics. So we know that alcohol definitely has impacts on other behaviors, and the American College Health Association in 2012 pulled out some stats on undergraduates who drank and what the consequences were of that drinking in the past year, what they reported the consequences being. Now again, we're excluding non-drinkers from this survey, but this is about 74,487 students were surveyed, so a good sample. 37%, were reporting they did something they later regretted. We have 16.7% reporting being physically injuring themselves. 2.5% another person, 2.2% just as a result of drinking are seriously considering suicide. 2% had sex with someone without giving their consent, and 0.6% admitted to having sex with someone without getting that person's consent. Now that's very concerning, seems like a small stat, but when you think about that's essentially the legal definition for sexual assault, and these are people self-reporting, we have some problems. So another national survey monitoring the future found that 36% of college students reported they have heavy episodic or binge drinking, and we consider that to be having 5 or more drinks in a row. And college students are significantly less likely to receive treatment in the past year for alcohol and drug disorders than their same age peers, non-college peers. So I think for a lot of folks, when we think of college, we think there's a lot of services and resources available, and that very well may be true, but something's happening when our students aren't accessing those services. And again, if you remember, this is the #1 identified disorder for students, and so clearly we have a huge gap here between there may be services out there. We may even be, soliciting our students, but something's happening and they're not getting in our doors. So another concerning issue for us is sexual violence. It's estimated that nearly 20% of women and 6% of men will be victims of sexual assault during their college careers. And among college women who have been surveyed, 12% of rapes were only about 12% of rapes were actually reported to law enforcement. And again, when we start talking about drug and alcohol being involved, we unfortunately have a lot of women who are not reporting, even lower numbers of reports, because again, alcohol having that direct impact on behaviors and further complicating the issues. So sexual assault strategies for intervention and education. Unfortunately, the field of sexual assault isn't quite as in-depth. There isn't as much empirical research available as there is around the field of alcohol. But we do know some important things, especially when we're sort of designing our intervention strategies on campus. We know that a number of studies have provided evidence for gender-specific programming. And we know that when the audience is younger and the curriculum content is more focused on healthy relationships, so we're talking more about communication, more about boundaries, as opposed to preventing rape, that we have better results, and those mixed gender audiences flow a little bit better. Longer interventions, so the length of time that the students are actually seeing, hearing, and engaging in that material seems to do better in altering both rape attitudes and rape-related attitudes. And so analysis is suggesting that the content of the program, the type of the presenter, I think there's a lot of focus on a lot of campuses around peer education, but we're finding that in fact students trust more and engage more with professional presenters around some of these topics as opposed to peers. And gender of the audience is definitely important, and the type of the audience. So what groups are we talking to? A lot of the education we do at the University of Washington around sexual assault, we do group-specific locations. So we'll do it in the residence halls. We'll do it in the Greek communities. We'll do it for student government. There's also general education that's available to everyone through orientation, but we really are recognizing that we have a lot more engagement and impact when we're actually talking to those specific groups. So some more concerning gaps. 80% of suicides on college campuses involve students who were not seen at counseling centers. Approximately 3/4 of students with depression who felt like they actually needed help and met the criteria for depression, and only 1/3 of those students who were meeting the criteria actually received help. And almost 96% of students with an alcohol use disorder received no alcohol services of any kind. So what are we doing about it? So we know that screening is essential, and I think you all know that as well. It's a matter of getting that screening into our health centers and our mental health centers. We're really trying to catch those students who may not otherwise be identified. We also know that brief interventions with college students, skills-based interventions, motivational interviewing, personalized normative feedback, these are all really effective measures for addressing alcohol and reducing drinking for college-age students. So a lot of you may have heard of BASICS. We know this is an incredibly effective strategy. It's a brief alcohol screening and intervention for college students, and it really focuses on harm reduction approach. It utilizes motivational interviewing. It really engages with students to come up with strategies for how to reduce risky behaviors, risky drinking. And high-risk drinkers who participated in BASICS significantly reduced both drinking problems and alcohol consumption rates compared to their control groups. So again, we know that this is an effective strategy. We know that if we can get this screening into our health centers, mental health centers, that we can go a long way in sort of catching those students, those large percentage of students who we know are accessing health services for other reasons. Maybe they're coming in for flu shots, but if they're not being screened, we're missing out on the opportunity to address some of these other issues. So another really great program is the National College Depression Partnership. They have screened over 58,000 students in 8 different schools and identified 801 students just through this screening process alone. And over 35% of those students were racial ethnic minority students. So again, really at-risk populations that we tend to miss. Improved clinical outcomes for at-risk, underserved college students through early detection, proactive follow-up. It works, it's working. Again, another nationally recognized program, and I'd love to see this sort of spread a little farther. So at the University of Washington, in my particular department, Health and Wellness, we have recognized screening is important. So we're working with our college campus to get screening into the appropriate places. But then we also know that not all students are hitting our health services. We live in a large urban environment, Seattle, and so students can go anywhere for their health care. We have lots of great hospitals around, healthcare providers, so we're not always going to have that opportunity to screen our students on campus. So we've incorporated strategic outreach into sort of our toolkit, and we really focus on reaching out to students who hit the radar to try to identify early on what the problems are, bring them in, sort of assess what's happening, and then connect them to services. So some of the ways that we specifically utilize this in our programs, our student care program, it's probably our broadest based program, and it's tied very much into our consultation and assessment team. So I don't know if you all, I'm sure you've heard of, the behavior response, incident response team, sort of in response to Virginia Tech, in response to a lot of these horrific incidents that are happening on college campuses or with college students. Whenever we have a student of concern sort of hit the radar, as we like to say, we're directly involved in sort of identifying that student and hopefully proactively, preventatively bringing them in and sort of addressing what's going on. So we'll sit down, figure out sort of the multitude of issues that are usually at play, and then connect them to the appropriate services on campus. We also run the suicide intervention program based on the University of Illinois program with Dr. Paul Jaffe and the JED Foundation. And again, we're employing strategic outreach. So, we often have students writing faculty, letting them know that they're not going to be in class because they attempted suicide last night, or perhaps they'll write something concerning in their papers, or sometimes issues come out in Greek living environments or residential life. Sort of all those reports randomly around campus are filtered through our department. Again, we're reaching out, bringing those students in, connecting them to the healthcare services, mental health services on campus or off campus if it's more appropriate. Not all students, shockingly, feel comfortable going on campus, and so we will accommodate those students if they prefer an off-campus provider as well. So again, we're coordinating care and monitoring and following up with those students. So our Sexual Assault and Relationship Violence Information Service. This service has been around for a while, SARS, and no, SARS does not match the title, but the name, it has recognition, so we keep it. Students know about this, fortunately, and so they access this service on their own, but as you remember in the previous slides, sexual assault victims are not likely to report to law enforcement, to the campus, to anyone, and especially when drugs and alcohol are involved. So anytime we receive reports, and again, we're getting reports from, sometimes when they report to police, if they do, we'll get those reports and reach out to them. We'll get reports from Greek communities, residential life. Again, sometimes students are disclosing to their faculty or TAs. And so we'll make sure that students know what resources are available to them. There's a lot of energy right now around Title IX and a lot of making sure colleges and campuses are really making sure our services are widely available to students. And so that's one of our missions, is to make sure students understand what resources are available. So not just the medical and mental health resources, but we actually explain the judicial process, what it looks like to report to the campus authorities if the other individual, the alleged perpetrator, was also a student. They have the right to go through our judicial process and hold that other student accountable. We sort of map that out, show them what that looks like, and then assist them if need be. We can also facilitate reporting to the police. So a lot of students access our services before they've talked to anyone, before they've accessed healthcare, before they've talked to police. So again, we're sort of showing them what that looks like, hopefully trying to make it a little less scary process. And if they want, our advocates are available to walk them through that process. Our alcohol and other drug education and intervention service is run by Dr. Jason Kilmer, our assistant director, and he's the one who's really going out to the health centers and providing basics training and making sure that folks know what that service is, that they're trained in it, providing that intervention, our screening technique. He also does a lot of education and partnering with our various partners on campus. So again, Greeks, residential life, all those folks who really are sort of the high-risk populations, we're reaching them. And he also does his one-on-one work with students, and so it's not judicial. We're very different. Health and wellness is not judicial. Again, we're not police, so students are going to get in trouble if they're reporting, disclosing that they're struggling with alcohol. We'll make sure that they get to the right place, and it's we're not confidential, so that is an important distinction. So again, we're not a counseling center. And a lot of times, especially when we're dealing with students of concern, we're very upfront and open about what we share and what we don't share. Obviously, we're beholden to FERPA, and we don't share a lot of information about students unless, it applies. So that's my quick capture of health and wellness, and I just wanted to say thank you so much for allowing me to be here. And I also wanted to give a little special shout out to my colleague, Jason Kilmer. He really is our inspiration for bringing evidence-based practices into the everyday work we do. And it's been sort of a professional goal of mine to tap into our researchers on campus and make sure that we're not just blindly providing intervention services and education, that we know what's effective and that, there's something behind it and there's a reason why we're doing it. So, thank you.